Hi, I'm Justin Kainer. I'm one of the leukemia faculty at Weill Cornell Medicine. Here at ASH, we presented our real-world data on patients who have acute leukemia of ambiguous lineage, which includes mixed phenotype acute leukemias and acute undifferentiated leukemia. And those represent a very difficult to treat subset of patients. They range in age from 18 to as old as 89. And generally speaking, the treatment strategies have historically focused on lymphoid regimens, including chemotherapy, which represents a difficult approach in patients who are older and unfit. What we showed in our data set is that patients who have mixed phenotype acute leukemias or acute undifferentiated leukemias who are either older or unfit, we showed long and durable responses to azacitidine and venetoclax, a typically AML induction regimen. And what was novel about this is that the responses in this subgroup were much more than would be expected. So we had about 7 or 8 patients who got these regimens, and some of them, about half, had exceptionally long remissions measured in years, which if you compare it to the VIALE-A study in AML, for which venetoclax combinations with azacitidine was approved, it compares favorably, of course, with the nuance and caveat of small numbers. So we believe that the approach of using azacitidine and venetoclax in older, unfit patients who have acute leukemias of ambiguous lineage may prove to be a safe, effective regimen that can potentially lead to durable responses, remissions for a subset of patients. Moving forward, I think it would be wise for protocols to be developed looking at this in patients who have mixed phenotype acute leukemias and acute undifferentiated leukemias, with the idea of using an azacitidine venetoclax approach in these patients, again, to minimize toxicity and maximize efficacy. So we will be seeing, as data comes along in the future, whether this can be spread out to other institutions and maybe sort of picked up as a standard of care.